Good morning, everyone. Good morning, Dr. Mike.
Good morning, Brock. How's it going?
It's going great. We're back for another week of Pet Talk with the Pet Doc. I'm Brock from Wendy Bell Radio. This is Dr. Mike. If you're new to the show, 38 years of experience in being a veterinarian, at the forefront of everything in the vet world, which we know ends up turning into the people world. So we take your questions. So get your questions in. You can ask on Rumble. You can ask on either Dr. Mike's Facebook pages. If you ask on my Facebook page, I cannot see it. So if you're on Rumble or if you're on the Wendy Bell Radio Network app, you can ask a question there and I can see that. Let me say right off the bat, give us a follow. We're here every Saturday, probably not next Saturday because of the holiday weekend, and I'll be traveling. But we're here every weekend trying to give out just free advice for your pets. This is no politics or anything like that. It's just about your pets. But give us a follow, give us a Rumble. Rumbles help the show, and we truly, truly appreciate it. So I'll turn it over to Mike. Mike, is there anything you want to talk about this week right off the bat? We do have some questions already. So
There is. Just one thing I wanted to mention. Somebody had asked me about coconut oil and said that they're hearing so much bad press about nut oils. And coconut's not a true nut. I believe it's a fruit, like a peach or a cherry, the pitted fruits, but it's not a nut. So it's not a nut oil. And coconut oil has what's called medium chain triglycerides in it. And medium chain triglycerides are very ketogenic. They're great for metabolizing inside the body if you have cancer, if you have Parkinson's, if you have anything that needs fatty acids. These medium chain triglycerides are very, very easily converted in the body to medium chain omega fatty acids, into the fatty acid products, which are very, very essential in life. And they cross the blood-brain barrier very effectively, and they can help with cognitive decline in dogs, dementia in dogs. I am not giving people advice, but it's really helping people with Parkinson's too and things like that. So it's probably not the most efficient medium chain triglyceride. And you have to be very careful if you're going to give it to your dog. Don't start. We've had dogs get pancreatitis and die from people giving coconut oil to their dog. So I'm not recommending people go out and start giving ad lib coconut oil. But if you speak to your veterinarian, they'll have you start slowly and give, maybe a teaspoon a day, and then you can up it a little bit over time. But you have to speak to your veterinarian about that because that's an individual variation. But those medium chain triglycerides from coconut oil, remember, it's not a nut oil, so you don't have to worry about that, and are very, very effective inside the body. They even go down, they speculate the way it helps Parkinson's disease in people is it helps one of the cranial nerves. There's 12 cranial nerves that come out of the brain. One of them is the vagus nerve. And the vagus nerve gives innervation to the heart, to the intestines, to the bowels. And it's very, very important, of course. And they say that pathway helps the medium chain triglycerides from the gut to the brain, which is an incredible pathway. And they can pass through that very, very easily, that blood-brain barrier. And not a lot of things can. So to answer that person who was asking me, what do I think about coconut oil? Should we stay away because we're hearing bad things about a nut oil? No, you don't have to stay away from it, but please get advice from your veterinarian before you give that to your dog or your cat, because you want to make sure you're doing it properly. And don't bathe them in it. Or if you do, make sure I don't get the benefit, because if you bathe them in it, they're going to lick it off their fur, off their skin. And that's how we got a dog with pancreatitis that died. 5 days in the hospital in the emergency clinic, and that dog ended up dying. And it was a very young dog, and it was very sad. And the owner obviously didn't intend to do that, but that's what resulted. So please use the guidance of your veterinarian before you give coconut oil to your pet. And but I am a fan. I am a fan because it is in that carbon chain length, the medium chain carbons. I think it's 8 to 12 carbons that are so efficient for crossing that blood-brain barrier and helping animals with cognitive decline and other things that are going on in them that could be very useful for. So yes, coconut's not a nut.
okay.
I don't know why nut's in the name, but it's not a nut.
Well, let's start. Someone sent me a question. I'm not going to read the whole question. She gets into really detailed stuff. So we're going to try to keep this broad and a generic answer, because Jamie is probably not the only one with this question with 4th of July coming up, and we'll address it now, and we'll address it probably towards the end of the show of fireworks. What, dogs that are getting afraid of fireworks. She said that her vet said Benadryl and another drug, Cilio,
Yeah.
but not sure about the side effects and is it safe. And so maybe if we can just in general talk about fireworks and pets, what's the best thing for it?
Well, first of all, Cilio, what her vet mentioned, is a prescription product. It is an anesthetic type product. It takes like 20 minutes to go into effect, and it lasts for about 2 hours. So that can be real effective as a last resort. I don't use it. I don't prescribe it, but I've heard that it does a very good job for about 2 hours. So if you're at that late stage and it's too late to try things, then yeah, I do recommend that. I had a great client of mine and a friend this morning. She texted me and said, is there any chance I could prescribe some trazodone for her dog, because the fireworks are just overtaking all of the natural things she's using? And of course I did. So there are instances where your veterinarian will prescribe something to help calm them during the fireworks and thunderstorms, because this is the time of year. But if you have time, and Brock, I think it's on our website, but I may be wrong about this because everybody keeps asking me about it, and I'll try to make sure, my son's not here, that he gets it on. But the veterinary supplements that I talk about a lot, I just pulled it up, so I'm reading from it. Composure Pro from VetraScience. It's a chewable treat for dogs and cats. Excuse me. It's really good for fear, noise phobias, anxiety, and stress. It has a lot of things in it that are natural. Theanine, thiamine, tryptophan. So it works naturally through the brain channels to help calm them down. Another one's called Nutrix. That's more for cognitive decline, I think. It works by binding calcium. It's a calcium binding protein, and it seems to help dogs that have cognitive decline. But on this list, there are a lot of things that you could try to see if it will calm your dog. One of my favorite for thunderstorm season and fireworks season right now is called homeopathic aconite, ACONITE, or aconitum. And the homeopathic is non-toxic. People in the past have looked up aconite and said, Doc's trying to poison my dog. No, I promise you, aconite, homeopathics come in centesimals, C. So if it's 3C or greater, 3, 6, 12, 30 C, that's how they come in the bottles. They're little bottles. They look like little tiny tabs, like those little pelleted candies that we used to like when we were kids, or you put them on cakes and things like that. That's what they look like. And for the different sizes, small dog, you get 4 twice a day. I put them in a folded piece of paper and put it right into their cheek pouch. And then medium-sized dog, you give 6 twice a day, and then 8 twice a day for a large breed dog or a giant breed dog if they're real nervous. You just pour it right in the cheek pouch. They stick there, and they absorb right away. They're a little sweet. They have a little bit of lactose. It will not cause lactose intolerance. But that homeopathic helps with fear, helps calm the cortisol. They used it in Europe in children the night before surgeries, and it was phenomenal. It helped lower the cortisol levels and the stress and fear of them going into surgery. So it's an incredibly effective product in 2 out of 3 dogs. I don't know why it doesn't work on that third dog. When I used to do the program with Brock on KDKA radio for 11 years and Rob Pratt, we polled people. Remember that, Brock? We had 100 people. Rob did it. We just had people calling in every weekend, letting us know if it worked in their dog or didn't work. And literally, we ended up with 66 out of 100. So it truly is 2 out of 3. I learned that from an old boxer breeder, a friend of mine, when I was in Long Island, that went to a homeopathic retreat. And she came back. She says, Doc, have you ever heard of aconitum for thunderstorms and fireworks? I said, no, I haven't. How are they telling you to use it? I'll share that with people. And it just turned out to be one of those tricks in the bag that can be very helpful for an individual. And I used to think it wouldn't help a border collie because they have an inherited fear sometimes where they're always trying to climb behind the toilet bowl and things like that. And the hugs don't work. The storm blankets and all of those don't work. The storm shirts, thunder shirts, they don't really work well on the border collies in my experience. And one of my friends tried this in his dog, border collie, and he said, I can't believe that I heard you saying this for 3 years, and I never tried it in my border collie, and it worked like a charm. So try it in your dog. It's worth a try. Might be a little bit late right now. I don't know. Give it twice a day, and you can give it right through the season. It's incredibly safe. They're rendered non-toxic, and Centesimal is just an energy, the way that they're shaken and things like that. But I won't get into that. But if you store them, if you do order it, you can get it online. If you get some of that aconite, homeopathic aconite, do not store it on your microwave. Don Blosser shared this with me years ago. He worked in the Bach flower remedies out of England, rescue remedy and the Bach flower remedies. And he was able to get us a source of aconitum when nobody else could find it. You can find it right now, but it was going out of supply. He found us a source for the listeners, and he said, Mike, make sure you're telling them not to store it near energy, because that can sap the energy. So don't put it by your computer. Don't put it by your phone. Don't put it by the microwave. Store it in a cool cabinet, and then use it in your dog. And that's just good advice for any homeopathic. I hope that helps. There's a lot of things out there that are natural. Zalkene, cannabis can sometimes help these dogs. They have calming care, which is a probiotic you sprinkle on the food. Worked fantastic. My dad's dog for separation anxiety. So there are certain things that you can try, but you have to test it. And if it's too late and your dog's getting really nervous from these thunderstorms and fireworks, please ask your veterinarian. They could prescribe something that is effective. I do prescribe it for my clients, especially patients that have been in there a lot. And I don't mind. I don't chastise people if they waited to the last minute and didn't try these things. But I don't understand why you wouldn't. I would much rather use something natural in my dog. I'm the same way you are. I want everything natural if I can do it. And so I'm much more likely to try something natural before I start anything else. And aconite, homeopathic, you can't go wrong with homeopathic aconite. So remember, 3C or greater is rendered non-toxic. So most of the time you can't find 3. You can find 6, 12, or 30C. It doesn't matter. In each succession, the higher the number is, the less it's less and less amount of the aconitum, but that could be more effective. I'm not going to say 30 is more effective than 6, because I don't know that. But as you go up in number, it's not getting more potent, it's getting less potent, but that can work even better. And that's homeopathics. That's how homeopathics work. So hopefully that helps, and it'll give you some relief during this thunderstorm. And the other thing I'd like to say, because of 4th of July, we're going out to fireworks, and I had one of my friends say, "Oh, are you going to bring your dog?" That's a bad idea. I'm going to go to fireworks. I don't want to bring my dog. My dog's not fearful. I can shoot a gun over him. He's not fearful of those noises. But I just think it's not good advice, because there's a lot of people, a lot of strangers, a lot of sights and sounds that are just not a good place for pets, in my opinion. I know a lot of people take them and they want to expose them to these things. And I watch those dogs very carefully, and some of them are incredible. But I always caution people about doing that. I don't do it myself. And my dogs are trained, and I don't do that myself, because I just don't think it's a good idea. Try to keep them in, if you have dogs that are fearful, try to keep them in a center room, put some music on, some calming music. Heartbeat music works really well. Classical works well in some dogs, rock and roll in some dogs, country in some dogs. Try it.
It's like people.
Yeah, just like people. But classical is a good, safe bet. There is heartbeat music therapy, which mimics the heartbeat when they were in the womb. It's very calming for dogs. They blasted that in shelters, and you could just hear the dogs within 5 minutes all calm down. You hear 90 dogs barking and screaming and barking, and then they put that through the PA system, and then you just hear, like, within 5 minutes all the dogs stop barking. Really neat stuff. So look into it. You can buy CDs with heartbeat music therapy, or just try some music, anything to distract them. Remember, don't reinforce the behavior. If they're scared, don't go over, "Oh, it's okay, it's okay." You're reinforcing that behavior. Ignore that. Only reinforce positive behavior. Get a toy, start playing with them if they're real nervous, and try to distract them that way. If you hear loud noise, don't even draw attention to it. Just play or give them a treat when they do something good. But don't reinforce that scared behavior, because they learn from that. Dogs are smart animals. And when they get reinforced, they feel that's what you want them to do. So just be aware of that. Some people don't even think about that. Your natural tendency as an owner that loves your pet is to go over and hug them, is to go over and calm them. I know that. I'm the same way, but don't do that when they're fearful because you're just going to reinforce it. And I hope that helps. Just small tips that I hope that helps.
We use Law and Order.
No, there you go.
Yeah, we use Law and Order, and
that wouldn't calm me. That'd make me anxious.
To follow. But every time Law and Order is here, every time Law and Order is one of us is here watching it.
Oh, cool.
Let me rephrase that. My wife is here watching it.
Yeah.
So therefore, it's normal for the dog to hear Law and Order.
Right.
So I turn it up, and
you're used to it. That's great. Great idea.
So, okay, this is pretty generic from Lisa, but I mean, there's so many options here we can go through.
Well, don't let me forget. I want to get on to a Malinois question that was sent to me this morning. I don't want to do it right away, but I want to do it in the show.
All right, let's cover it after. How about we do it after this one? Because this is probably going to be a little longer because there's probably a lot of answers to this.
Okay.
Why do my dogs keep getting diarrhea? And we hit the poop question by 10:15.
There we go. So I don't know. I don't know why your dog keeps getting diarrhea, but I'm always curious about those cases. Just for my background, for your interest, I worked in diarrhea research for 5 years, 1981.
Really?
Yeah, 1980.
I know that.
Yeah, with Dr. Gerald Wood. He was my mentor. He's since passed away. I think of him often. Brilliant man, one of the most published, prolific writers, and the top journals. I think he had 170 plus publications. And we were working with enteric viruses, intestinal viruses, and some cryptosporidias, some protozoans that cause diarrhea. And it was back during the Ethiopian famine. So just to give you some background, the Ethiopian famine, when people heard about everybody dying in the desert, they were thinking they were starving. Well, most of them were dying of scours or diarrhea, electrolyte deficiencies, because they were getting diarrhea, and starvation has something to do with it, but the diarrhea was what was killing them, the lack of the electrolytes. So Dr. Wood was trying to find a solution that would cheaply, economically replace those electrolytes and get them better the quickest, the most efficiently. And we were testing it in the animals that we had viruses. Coronavirus was one of them. There were other viruses. That's why I know a lot about these different viruses, because I worked with them for 5 years and I was in vet school. So anytime I took them to the pathologist, hey, Dr. Plentz, you mind if I come in and see what you're doing? Come on in, Hutch. They go to electron microscopy. Come on in, Hutch. Hey, Nancy, you mind if I come in? So I got this experience that a lot of my classmates didn't get. So I liked diarrhea because I had such vast experience with these guys. I know that sounds
great. That may be the first time I've ever heard someone say I like
the challenge of diarrhea cases. I guess that's a better way to say it.
Yes.
It's because there are solutions that sometimes we don't think about. So you observe the animals, and my dad taught me that when I was young. He just observe nature, observe what the animals are doing. The animals that stopped eating when they got diarrhea, we'd give them a virus, we'd take them out by C-section, put them through a dunk tank before they took a breath, an iodine dunk tank, put them into isolator. That was called Notobiotics, known life, germ-free isolators. And then we'd give them a virus that causes diarrhea. Wouldn't kill them, but it would cause diarrhea. And then we would study. And then we would find what could we give them that would get them better the quickest. And we were looking for natural solutions, electrolytes and things like that. And the animals, one of the observations that we made was this, that the animals that stopped eating for 2 days, they kept drinking. The animals that stopped eating got better quicker every single time. And the animals that ate through it took longer. So the animals that stopped eating for 2 days kept drinking. So they fasted for 2 days but kept drinking. They just stopped eating, but they kept drinking, so they were hydrated. They got the diarrhea cleared up real quick. The animals that kept eating, maybe it took 3 days longer to clear up. So it was an observation. So that's something I share with people. I don't want to fast a puppy with diarrhea because they can get hypoglycemic. So I'm not telling you to fast your puppy without speaking to your veterinarian, or fast your dog, but I'm just giving you this observation that we watch. And I don't mind if they miss a day or two of eating, as long as everything else is okay. They don't have high fevers, things like that, but they have to keep drinking. So when I see dogs or cats that get chronic diarrhea, I want to get down to where in the intestine. Is it the stomach, the upper small intestine, the duodenum, the middle small intestine, the jejunum, the last third of the small intestine, the ileum, or is it colitis? Is it in the colon? So I want to localize the best I can where that diarrhea is being processed or where it's caused, where the cause is in the intestines. Sometimes I can only tell you small intestine, large intestine. I can't localize it because I'm not doing all the tests necessary to localize it, but we can. We do know how to localize this. And sometimes just doing vitamin, tests and things like that. People have maybe had their dog tested for folate and cobalamin, 2 nutrients. So, and it helps us localize where in the intestine something's going wrong. We used to do what's called xylose absorption curves. And so not xylitol, xylose absorption curves. It was a sugar. And we knew by the absorption rates in the blood where it was being efficiently absorbed from. And we could tell where in the intestine then the disease was wreaking havoc. And then we could help better treat it. At any rate, so when I hear chronic diarrhea, I want to know that there's no parasites. Sometimes, even if we check their fecal several times, remember, we're looking for eggs. And if they're not shedding a lot of eggs, we don't see them. Whipworms are a culprit. They can shed thousands of eggs at once, and they can shed no eggs at all. Coccidia is a protozoan that can do the same thing. How do they get these things? On the ground, eating, deer feces, rabbit feces, you get it. And that's how they get them. Dogs always have their nose on the ground. They're always tasting things. And at any rate, that's why gross, I know. But that's how they can get these things. So I want to make sure they don't have those. And sometimes we super deworm them for all of those things to make sure, because maybe they're not shedding. Whipworms, for instance, can look like cancer. Dog can start wasting away. You do 5 fecals, you don't find any whipworms. Then you do the 6th fecal, and there's thousands of eggs. And you're sitting there going, why in the heck? And so I don't do 6 fecals. I deworm them if I'm speculating that maybe they have that. And nobody's opposed to us deworming their dog, super deworming their dog if they have chronic diarrhea. You shouldn't be anyways. So then is it an intestinal bacterial overgrowth? We can help that with maybe Tylenol powder or Flagyl, metronidazole. I don't prescribe antibiotics right away, but I will say this, and I learned this from an Ohio State doctor, and I feel really bad that I don't remember her name. My associate, Dr. Kafines, told me she was wonderful. Well, I was in a microbiome conference online that was being held in Europe, an 8-hour conference, and I really liked her advice for chronic diarrhea. She said 70% of the diarrhea that comes to her could have been solved by just giving the dog extra fiber. And that's huge. Extra fiber, psyllium husk. You can get it online. You can get it in a powder form. The original Metamucil is psyllium. It's just fiber. It's soluble fiber. So it's one of those fibers that is very effective for the intestinal wall. Fiber's good in absorbing moisture and diarrhea and retaining moisture and constipation. So fiber is good for all the GI things. If you're having constipation or having chronic diarrhea, it's a great thing to try. And how do you do it? Buy psyllium husk, get it in powder form, get it on Amazon, and a half a teaspoon to dogs under 10 pounds a day, a teaspoon to dogs maybe up to 25, 30 pounds, and then a tablespoon on up to tablespoon and a half a day would be a good amount to give. Remember to give plenty of fresh water, and because it can gel up. You can put it on dry food. They'll eat it down, but they want to drink a lot because sometimes as soon as it gets some moisture, it gets a little hard to swallow. So if anybody's taken fiber, they know that. You just have to drink it down. But it's a great thing to try, just adding fiber. My German Shepherd is on a diet that has extra fiber in it because he has recurrent colitis, which is probably more an anxiety thing. I hate to admit that in my house, but there's a lot of activity in my house, a lot of children, a lot of grandkids, a lot of animals. Always have new pets coming in the house because my daughters and friends, they bring their dogs when they come to my house. They're well behaved, they're trained, and my dogs are used to that. And maybe the shepherd gets a little anxious over that and gets colitis a lot. So I put it on a prescription diet, Purina EN with extra fiber, and it works beautifully. So fiber is what really helped him. And it may help your dog, but the gastroenterologist at Ohio State shared that number on that forum. She said 70% of the dogs probably wouldn't have needed to see her if the vets just prescribed fiber. So I'm sharing that with you. It's a very safe thing to do. It's a very easy thing to do. Ask your vet. I don't think your vet's going to be opposed to it at all. Sometimes they get a little bit of gas when you first put them on it. Their body will adapt to that. But fiber, the good bacteria in the gut likes fiber. So it's food for the good bacteria as well. So hopefully that helps. I know it's a long discussion. I don't put them all on antibiotics. I like to localize. I don't super deworm them all. It all depends on what that condition I think is being caused from. And in German Shepherds, we have to think about their pancreas. Sometimes they're not secreting enough enzymes and they get really thin, really sick, have trouble putting weight on, and almost look like cancer. And we just need to add enzymes to the food. I sprinkle enzymes on my dog's food every day, twice a day. And, Prozyme is what I use. I have it in my container with the omega-3 fatty acids, and I use Fortiflora. I use probiotics 2 weeks on, 10 weeks off. I am going to be doing a microbiome test on my dog, and just quickly, I'm not ignoring people that have sent me. I have a whole list of people that are waiting, and if you're interested, certainly you can get on that list too for having your dog or even yourself. I can guide you on that. I can't do it, but I can guide you to who can help you immediately, and so you can get a kit and test yourself. But for that microbiome right now, so when you start a new business in the United States, you need a web page. You need to have a place where people can go to get information, not just a Rumble, podcast that we did with Dr. Bill. I should have put the link on this show so they could go back and see that. But it's a 20-minute section with Dr. Vasilis Paspaliaris that explains all of this. But the web page and all of that, I'm not the final editor. I'm the guy that they give me information. I go, that's way too complicated. I distill it for my audience, and I'm not being critical, but sometimes it's written for doctors. It's not written for lay people, and I write for lay people. So I distill it, and then I have to send it back and get approved so that the message is correct. It's not being changed, and that goes to, in the end, Dr. Vasilis Paspaliaris. And there's other good doctors involved in University of South Texas. So it just takes more time than I would like. I'm doing my best. I promise you, as soon as they have prices on it and I have a website to send you to, I will be here shouting it. It's not me that's holding it up. It's not anybody that's holding it up. It's just the new process. I have the kits, but I can't send them to anybody. I can't even test myself. I don't know what the cost is yet. I mean, how crazy is that? So he sent me the kits without a cost, and I get it. It's just the beginning. And so I'm not ignoring people on that. I just want to mention that.
And we'll make sure we'll put those links up when they finally can get to it. And we'll put them on the Rumble feed. Mike will put it on his blog. We'll put it on the Wendy Bell Radio Pet Talk Show page. Now that's wendybellradio.com is now officially moved over. So that nice. Pet Talk page will be there. So we'll have the links there too. That way you guys can get to it nice and easy. Just you don't download anything. It's just a regular web page.
Right. And when I say to you, I won't forget this. Just hear me.
I won't let them because I'm on the list. Right. I won't let them.
I'm as excited about. I'm on the list too, and so is my dog. I'm as excited about this and changing the lives of our pets and people too, as I've ever been about stem cells. And people that have heard me speak on stem cells, they say, "You're so passionate, Mike." And I said, because if you got to see the things I've got to see, you would be too. And so I'm as excited about this microbiome as I am that. Excuse me.
And what you're talking about is you're excited about having answers.
Yeah.
And information.
And I like natural things. I like natural things. A lot of people appreciate that.
And I don't know if Mike was trying to do this, but it's a great segue to the next question you got this morning. Sure. If you want to read that question or some.
No, go to the next one. It's a segue.
Oh, you don't want to answer the TPO yet?
No, I will. I thought you said it was a good segue. Oh,
no,
good segue to this one.
Yeah, because you said you were excited about stem cells.
Yeah, sorry, I'm going to read this. This was from one of my texts this morning. It says, "Hey Hutch, I have a good friend who competes in Mondio. That's a world-class activity with Malinois. And a lot of people, if you don't know what Mondio is, Mondio, go on to YouTube or Rumble and search it. It is unbelievable. So,
is that a dog?
Yeah, this is what dogs do. It's unbelievable what they can
do.
Okay.
I didn't know that was a dog.
Malinois, and I'm not kidding you, scale ladders up and down, walk across tight ropes like nothing. And it's unbelievable. Walk along a ledge, a little 2x4 ledge on a fence. It's unbelievable what some of these dogs are trained to do. But at any rate, so it's highly athletic activity. And so I just want to do that. And she has a smaller female Malinois. She has been told her dog needs a TPLO, which is for a ruptured cruciate ligament in one of the legs. And I don't know if she's watching right now. If you are, I can certainly talk to you off camera. But the TPLO is a very aggressive surgery, and sometimes is needed in these really athletic dogs. But they go in at the top of the tibia, the shin bone, in a dog. So the cruciate ligament runs between the femur, and the thigh bone, and the shin bone. It's underneath the kneecap in the joint. It's a crossing ligament. That's why it's called a crucifix. The one that attaches at the front of the shin bone, at the forward edge, in that joint, is called the cranial cruciate or the anterior cruciate ligament, ACL or CCL. I don't like CCL because the other one's called the caudal cruciate ligament. So CCL could stand for that too. So I like ACL, anterior and posterior. So the ACL has been ruptured. So that's an instability, creates instability in that joint. Well, on a dog, the top of their tibial plateau, the shin bone, is tilted a little bit. So what they do is they go in and take a wedge of bone out, and they level the tibial plateau. It's called a tibial plateau leveling osteotomy. The osteotomy is where they take out the wedge of bone, they level it, and then they put a plate in with 6 or 8 screws. And that's a very aggressive procedure, but it is effective. And hats off to the orthopedists that first decided to do that. Yeah. They're just looking for better ways, because none of these surgeries are perfect, none of them. And in the surgeon's hands, the TPLO can be very, very effective. Are there complications? Of course there are. They can reject the screws, they can reject the plate, they can get an infection. That plate can become a nidus for cancer down the road. We're learning that with titanium. And they share those complications. I read the reports thoroughly. When a surgeon writes up a report, I want to know what happened in that surgery if it's my client or my patient, my client's dog. And so I read them thoroughly, and they do. They share all this news of all the potential complications. And 10% of them have those complications. And that's through the orthopedist mouths. I agree with that. I mean, I get to see them too. They do the surgery. I get the follow-up in a lot of cases. And you do see about 10% of them. Well, I do a lateral suture where I put a nylon fish line, basically, artificial, outside the joint. And we use that to hold stability, to create stability. And 90% of those do well too, depending on the size of the dog. Giant breed dogs, I would always refer for a TPLO, because I just don't think the lateral suture is the best procedure for that. But board certified vets have disagreed with me on that. They've said in the right hands, sometimes they put in devils, that the lateral suture works just as well. So I don't argue about that. I just think that they're all good procedures in the right hands. If you do the procedure you're comfortable with and you've done for a long time, that's probably the right procedure. And I only do the lateral suture, and I use stem cells. And the stem cells help ward off the arthritis that follows. So anytime a dog gets an injury like that, University of Minnesota did a study around 2014. It was published 2015. 335 dogs were in it, and they looked at these dogs with recent ACL tears within 30 days, and they found they did one of 3 procedures. They did a TPLO, one of 4 procedures. A TPLO on a fourth of them, a lateral suture like I do on a fourth of them, a tightrope procedure on a fourth of them, which is out of Missouri, Dr. Cook, and then the other fourth was medical management. Braces, leash confinement, non-steroidals, nutraceuticals. I recommend that anyways, but they, not the brace necessarily, but leash confinement and nutraceuticals, I certainly recommend. Anti-inflammatories while they have pain, I certainly recommend. Well, all of those dogs were looked at a year later, and they wanted to see which ones had the worst arthritis a year later, because it's an athletic injury. It's the football injury. You hear about the football players getting their ACL fixed. Well, when they're 40 years old and they're done with football, they're having trouble walking upstairs from the arthritis that follows those procedures. And in those dogs, the most severe arthritis, there was no statistical difference in what procedure was used. Whether you did medical management or the TPLO, they all had arthritis a year later. So that was pretty telling to us veterinarians that doesn't matter. I always thought stabilizing that joint, like with a lateral suture or TPLO or tightrope, would be better than medical management if they had a complete tear, because of the instability or the drawer movement. It slides like a drawer. The shin bone slides forward when that ruptures. And they chase the squirrel. They use all 4 legs. It's rubbing back and forth. And then after they get to the squirrel, they hold their leg up because it hurts now. because they cause that friction. Well, it was not true. They all had arthritis. So with stem cells, I went up and I was asking the doc if they considered doing stem cells at the same time. And the answer was no, they didn't do that. They would like to do that. And that's ongoing now. I don't know if it's University of Minnesota. I was wrong on that when I said that to somebody, because I talked to somebody there and they said, we're not doing that study. But somebody is blinded right now, so I don't know who's doing it. But they're doing that to see if they can decrease the amount of arthritis. I provided 14 films from dogs that I did lateral sutures on with stem cells. And a year later, 12 to 14 months later, we took x-rays of those dogs, and the ones that had stem cells, 13 of those dogs were better than they were the day we did surgery, the arthritis I'm talking about, or the same. They didn't progress. They were better or the same. The 14th dog got worse. I wish I knew why. I don't. But, so maybe his stem cells weren't as potent. Maybe they went somewhere else. I don't know. I don't tell the stem cells what to do. They go and do their thing. So maybe there was inflammation somewhere else in the body we didn't know about, and they migrated to the inflammation, because they do that like a guided missile. But at any rate, that was incredible information for us at 13 out of 14. And one of the docs said to me, Mike, when this is unblinded, I'll let you know. You'll be the first call I make, because I provided that proof of concept. And I said, well, that's okay. I already do know. I provided the x-rays. So there are other alternatives to the TPLO. And that was basically the question. She was told her dog needed TPLO. And the tech that sent this to me was not a tech of mine. She has these Malinois. And she came to me after going to the University of Tennessee. They told her dog needed TPLO. It was a career-ending injury to that dog. And she brought her dog to me, and I believe we just did stem cells. She wanted to try that first without doing the surgery, and her dog went back to competition. Now she works for me. She moved to the area, now she works for me. But and she was asking me for that friend, would I talk to her about alternatives to TPLO? And some of the surgeons hate when I do this, but I don't care. I have the experience that I have. I share it. Most of them don't have the experience I have with stem cells. I try to share it with orthopedists. There's a lot of orthopedists using it. There's a lot of orthopedists using PRP, platelet-rich plasma now, where they didn't use it in 2010. They used to tell me that was a bad idea because they weren't doing it in humans. Well, guess what? They're doing it in humans. They're doing it in animals. Everybody's doing it. So sometimes we're laggards in our profession. You have that curve, and when you get the information up the top of the hill, a lot more vets or doctors start using it. And I happen to be out here at the beginning because I was looking for alternatives. I'm not so special. I wasn't satisfied with the standard that we were doing. The standard of care just wasn't working that well. So I was looking for other things. And I got into that very early with the PRP, platelet-rich plasma, and then stem cells. Stem cells are the gold therapy. And then, you'd think when you get over the top of the hill, all the vets would jump on. No, guess where we stand? We're down at the end of that curve in the last 7%. That's where the vets are. We're the laggards. We want to see tons of proof before we switch into it. And in this field, in regenerative medicine, I was at the beginning, not bragging about that. I'm just saying I was at the beginning because I wasn't satisfied with what was happening. I've been a vet a long time, and I'm honest. And if something isn't working well, I'm not happy. So I want the win-win-win. I want the dog or the patient, the cat or the dog, to be better. That's number one win. Then the owners are all happy. That's number two win. And then I'm happy. That's number three. That's the win-win-win. So I wanted to share that. That was a great question for that. There are alternatives. And I'm not saying you need to do, I don't know the case. I'm not saying you need to do it my way. I'm just saying you need to hear all of the options. And sometimes all you hear is TPLO, TPLO, TPLO. Why? Because general vets now are getting out of vet school. This is not a critique. My son was included. He agreed with me. He goes, Dad, you're exactly right. You get into vet school, they start talking to you month one about becoming a specialist, about staying in school 4 years longer. Why do you think that is? And at any rate, a general practitioner, I have a license to practice medicine and surgery as a DVM, a doctor of veterinary medicine. When I graduate veterinary school, I have that license. I don't need to become a specialist to do bone surgery. I don't need to be a specialist to do cruciates. And it doesn't mean the specialists are the only ones that know how to do that stuff. But a lot of students, when they get out of school now, young veterinarians are going into practices, corporate practices. Yep, I'm saying it. Corporate practices They don't get to do any of these surgeries. They don't get taught these surgeries. So then it goes to the specialist. And so as soon as they see an ACL, they send it to the specialist, and they don't talk about all these options. And to me, that's sad. And because the specialists, at least the specialists around me in Pittsburgh, aren't talking about stem cells at all. So it's to me, that's a problem.
Yeah.
And so I share that. It's not a critique of any specific person, but they're just not talking about it and not even offering it. Not even, they can do it just as I can do it. So, and they like to say, oh, there's no evidence. Well, start reading. There's tons of evidence. 27 peer-reviewed studies in dogs showing cartilage regeneration, 26 or 27 out of 28. One of them didn't show cartilage regeneration. The others did. Peer-reviewed journals showed cartilage regeneration. A study was just published this month on going through and do arthroscopic surgery in people. And they compared it to going in and cleaning up the arthritis, cleaning up the damaged joint, the little debris in the joint. And then they compared it to doing arthroscopic surgery and then injecting stem cells. And guess what? Adipose-derived stem cells. Guess which group fared way, way, way better? No surprise to me. The stem cell group fared way better. 12 months, they were still pain-free, where the arthroscopic surgery helped for about 6 months. By 12 months, they were in pain again. That's so normal. That's so likely in the football players, the athletes. That's so likely that I can't believe they're not all doing stem cells. And part of that is the FDA hasn't approved it yet. I get it. So, because there is a friend of mine that's a board-certified orthopedist in human medicine who said, Mike, I want to do stem cells. The FDA has to approve it. I said, all right, I get it.
I think we're getting to the point where everybody's willing to get a second opinion and everybody's willing to look for for lack of better words, homeopathic or alternative style.
I just want people to have the information. I don't ever pressure anybody. People that come to me know that. I don't pressure anybody. Here's choice A, B, C, D. I'll go down the line and sometimes it's economics. Can't afford it. In my practice locally, Western Pennsylvania, it's cheaper to do a lateral suture along with stem cells and banking them for the life of your dog. So if they rupture the other ACL or end up with arthritis when they get older or end up with another disease that stem cells can help, we have stem cells for the rest of their life. And that's cheaper than doing the TPLO. That's not saying it's better. I'm not making that claim. I'm just saying it's cheaper. In my opinion, that's the gold therapy because of what I told you about the arthritis, no matter what technique you use. But I did see evidence, and Dr. Arnie Lesser is a good friend of mine. He retires out in Long Island, orthopedist, and he's always told me the truth about what's going on in his field. And he's a teacher too, incredible teacher. He taught me a ton in surgery. He said to me that the TPLO now in larger dogs down the road, 7 years down the road, is performing about 7 to 8% better than the other techniques, the lateral suture, the tight ropes, and all of that. And that to me is a significant difference. 7% is a significant difference because if I get a dog back, the dogs are quadrupeds. If I get them back to using all four legs, I only need to get them to 85%, and you and I can't see a lameness. 85%, they can, they're mobile. They're incredible. Their muscles adapt. Their joints adapt. They're incredible at 85%. So let's say in 7 years, they're down to 80%. Now you see them limping, where that 7% could still keep them in that area. So I do think 7% is dramatic. So it's but the stem cells are my favorite. We can always come back and do more if they start getting arthritis. There's been a lot of people, and this is good information too, that have had TPLOs on their dog on two knees. And we call them the suitcase dogs, where they're having trouble walking because they get so much arthritis. That's not an indictment of the technique used. It happens in all of them, as I just mentioned. But now they're having trouble with arthritis, and people came, I know my dog has metal in it, will the stem cells help? I go, they sure will. They still have a joint. They still have a joint space. Now, when you do an artificial hip and you put an artificial, head on that femur and then pop it into the socket, now stem cells aren't going to help that joint because that's an artificial joint. But with TPLOs, they don't make an artificial joint. They just put that, what I said to you, they remove that wedge of bone and put a plate in. And they're trying to modify that because when they do that TPLO, they cut through 2 more ligaments. I always said that. I always said, I don't get it. You're cutting through ligaments to fix a torn ligament. Only the orthopedist that came up with it would be the only one that would do that. But it did give some effectiveness. And so in some orthopedists, most orthopedists feel that's the best way to do it. So, and they feel that for a reason. They have good success with it. Their technique's good. But I would bet if they had good technique on lateral sutures, they would have just as much success with that. And the paper supported what I just said. 6 months out, on a force plate analysis, looking at these animals putting weight on that back leg, there was no statistical difference between the TPLO group and the lateral suture group that I use. They were all putting as much weight 6 months out. So that was pretty significant too. So I argue that those orthopedists could do any of those techniques well, and they would work probably just as well, except for that last study where you got the 7% improvement on the larger dogs. And I think that is significant and something people should consider if they're not doing stem cells. If you're doing stem cells, I think you're giving something way better. That's my strong opinion based on lots of evidence and lots of cases, over 2,000 cases. But it's I'm one guy, so
it's amazing.
People that don't use it deny it.
It's amazing to me that people are in for 20 odd years, that people are calling it new technology.
Yeah,
because
I know.
I've been listening to you for 20 years talking about it. So to me, it's like old hat almost, just because I feel like I've been in from the beginning too, because you've been telling me about this all from the beginning. So
I'm helping on the human side too. We have studies going on there that I wrote and through clinicaltrials.gov. And 2015, we first published those studies, those clinical trials. And I, at that time, believed in my heart that in 4 years, 5 years tops, we'd have it through the FDA. Here we are in 2024. We're still trying to get it through phase 3. It's amazing how many delays can be plugged in your path. And it's not self-imposed. It's imposed by others that might have money in the game, that sell a lot of pills, that want to sell a lot of pills, and don't want you using your fat to repair your joint before you chop off your joint. It's insane to me, and I got to stop there because I'll have a target on my back.
I say it all the time. There's no money in you being healthy. So
yeah.
So we're gonna, so we don't piss off the cat people.
Please, I love
cat. A couple of cat questions.
I was on KDK radio, I think Thursday morning, and there 3 cat questions came up, and somebody said, "It's about time you talk about cats." I always talk about cats.
Yeah. So I have this cat problem. Why does my cat like to chew on plastic bags? How dangerous is this?
Extremely dangerous. So probably they're playful. It makes noise. If you wrap up aluminum foil and throw it, they'll have a ball with it. If you hang, anything on a string and swing it, the cats will play with it. Well, plastic is light. It makes noise. They have fun with it. They have a rough tongue. It's very dangerous. If they smell something in it, they start licking, and their rough tongue can start pulling things in, and that can become a nightmare. Because then they swallow the bag, and we've taken plastic bags out of cats. And I've taken plastic bags out. I took this true story, a plastic bag out of a cat that still had sardines in it. So somebody put sardines in the plastic bag, and somehow the cat got it. He swallowed the bag with the sardines still in the bag when we took them out.
Wow.
I mean, it's just incredible. And the other thing, cats with strings, just while we're talking about it, I always tell people we check the mouth, we open their mouth, and we push the thumb up underneath their chin to raise their tongue, to look under their tongue, to make sure the string didn't get caused around, rung around the tongue. We had a cat come in, true story, that had a little piece of string sticking out of the anus. And I always tell owners, do not pull on those, just trim them. Do not pull on those. This cat, that was all the way down. It was wrapped under his tongue, all through the digestive tract, and it was starting to come out the end. Now you pull on that, what are you doing? You're sawing through those intestines. When we went in to do surgery on that, we had to cut it under the tongue, release it, and then we had to make small enterotomy incisions into the intestine. It was like an accordion, and release that string so that we could remove it out and then close those up. And so that's what can happen. Well, this week I had my first on Tuesday, my first in 38 years, first dog that had string wrapped around his tongue, that cut a big gaping wound in it. fair warning to those people that don't like gross things.
Oh, hell no. Show the picture. Hold on a second. I'm going to make it. Oh, I can't do that. Go ahead.
Can I show this? Hold on one second. I got to find it that I said this. Here it is. So there's the wound under the tongue. I got to try to put it. So you're looking under the tongue. Will that stay? No, it won't. Let me lock this. Okay. You're looking under the tongue at the wound that the string, that's after the string was cut. That's under the tongue in the frenulum.
That is gross.
Right there. It is gross. But it was wrapped around there. And while I was doing surgery, the intestines were accordioned. I could feel it in the stomach, and it felt like a band was sawing through everything. Thank goodness the dog's doing really well, and it did not saw through, but it wreaked havoc, believe me. And when I felt that band, I asked one of the techs, I said, do me a favor, look in the mouth and look under the tongue. And I inherited the surgery. I didn't do the initial exam. I said, look under the tongue. I guess the dog wasn't cooperative when they're trying to do that. And he looked on the tongue and he goes, there's a string right there wrapped around it, and it's making a gaping wound. I said, can you cut that? And as soon as they cut it, and they, you said yes. And as soon as they cut that, all the tension released, and I was able to do one enterotomy incision and then work the accordion to get that out of that one hole and then suture back up. That dog's eating again and doing well. But that would have been his death. And that was the first dog in 38 years that I ever saw wrap a rope around his tongue. And it's accidental. It was probably chewing on a toy and then stretched out rope and pulled on it. Who knows? That's what the owner thinks, because the owner has no idea how that happened. And some of the stuff that we pulled out that was attached to that looked like it was from a toy. So they won't be giving any kind of toys like that ever again. They'll stick with the Kong chews and things. So
yeah, right.
The things that you can supervise really easy, but supervise everything, please. A toy that works really well on my dog may not work well on your dog. And when they say indestructible, I have seen every indestructible toy be destroyed. So don't believe indestructible. They're good, but don't believe indestructible.
All right. This could possibly be my favorite cat question in 20 years.
Uh-oh.
Is there a 12-step program for cats and catnip? We grow it in pots, and when our barn cats partake, they just let the mice walk right past. That could be my.
That's a great question and comment. I love the sense of humor in this, the 12-step program.
Yeah.
No, catnip, it doesn't affect all cats, but it affects 2/3 of them. It even affects tigers and lions. I mean, it's unbelievable. The whole cat
doesn't like it.
Yeah, catnip. Well, it stimulates something in their nasal organs. I'll just put it that way. It's olfactory. And in some of them, it just makes them so giddy. It's unbelievable. And it's a happy reaction in one of my cats. And the other cat, it's not a happy reaction. So
it's almost like weed.
Yeah, probably, I guess. I don't know.
Different effects for some people. Some are sleepy.
Yes, but the catnip, like I said, it affects, usually it's 2 out of 3. I like it. I think it's fun. We have a blast with it. So that makes me laugh that you're growing catnip. And, catnip's one of those plants that keeps away bugs. So I know a lot of people plant it with their whatever other plants. I can't even think. Lavender and what's the one with the gold? Marigolds or something. Anyway,
sure.
There's people out there screaming at me right now because I don't know. My wife knows all of those. But catnip, if you plant them together, they all will inhibit the bugs around, so you can sit out on your porch and enjoy it. And the catnip makes the cats crazy. If they go outdoors, it makes them crazy. And I do have one that still goes, actually 2 that still go outdoors. They're my son's cat, and they got them from the outdoors. And you can't keep them inside. It's a nightmare. In the winter, they stay in, but in the summer, there's no keeping them in. So they're on all the vaccines. They're on the leukemias, the flea and tick products, excuse me, because they go outdoors. But one of them goes crazy over the catnip.
So this cat either needs to go to meetings or they need to get rid of the catnip.
Yeah.
Wherever it is, and only put it out when they're not looking. So
that's really funny.
I don't know where the meetings are for these cats, so that you're on your own to find those. But
I love levity added to these questions. That was excellent. Thanks for the question.
Here we go. Dr. Mike has previously talked about a vaccine for cancer treatments in pets. Can you explain what this is and what type of cancer it can be used for? Is this available at all veterinarian offices?
So one of them is, so there's 2 of them. There's an autologous cancer vaccine, which means We take your dog's cancer, or well, it's not in cats yet, it's just dogs. We take your dog, they're working on it in cats and humans. They have some for humans, but they take your dog's cancer, we remove it, we send it to University of Kentucky, Ardent Animal Health. You can look up their cancer vaccine, Ardent, Ardent, Ardent Animal Health, and you can look up their cancer vaccine. ACV, they call it, autologous cancer vaccine. And it gives you all the information on it. And your veterinarian can do that. So we send it out to them. The pathologists look at it, tell us if it's malignant. They purify the cancer cells into a vaccine. Takes them about 7 days. And then they add their unique adjuvant to it, which stimulates the immune system. They send it back to us in 3 frozen syringes. And then we give one intradermal into little rectangles on their back. We clip it, scrub it. And I do that as you come in and 10 minutes later, your animal goes home with you. We do it in the back. We scrub it, we prep it, and then we give the intradermal injections and make little bleps in the skin. We do it at day 0 when the vaccine comes in. We do it at day 30 and day 60. And the rationale is now the immune system can make antibodies towards that cancer, can turn against that cancer. So it stimulates the dendritic cells in the skin, which are, very, very good immune cells, to start processing that cancer antigen that is in your pet and make antibodies to it. It's beautiful because it turns the body against the cancer. Right now, it's going through the USDA trials for osteosarcoma, bone cancer, but we can use it in soft tissue sarcomas. We can use it in mast cells. We can use it in melanomas. There is a melanoma vaccine out there that's very effective. So I don't know why you would use that in a melanoma, but you could. Solid tumors, pretty much you can use it. Hemangiosarcomas too. And we're turning the body against it. And the rationale is that we're going to help 2 out of 3 of these animals live past the standard of care. And on hemangiosarcoma, dogs usually live 3 to 6 months. That's a blood-borne cancer in the spleen. And we had a Vizsla that was sending me videos of their dog running in a field 10 months after the surgery, 16 months after the surgery, 18 months after the surgery, and the dog succumbed in about 20 months. But it brought quality life for that dog. And that was an incredible testimony. And right now, those numbers are very accurate, about 2 out of 3. They won't make that claim because it's going through USDA trials, and they can't. They're not taking it to the conferences anymore because the USDA says you can't while you're in the trials. I hate these rules because it could be helping a lot of animals. But yes, your veterinarian is allowed to do it. If they go to that website, it's very easy. They send you a kit. It's very easy. And every vet can do it. It's in their skill set. The other thing is an allogeneic cancer vaccine, which means they have one for osteosarcoma, bone cancer. It came out of Yale University. Dr. Mamula is the immunologist who developed it. And there's a lot of oncologists that use it now, even one in our area that uses it, participates in this program in Western Pennsylvania. And they can give this vaccine to any dog with osteosarcoma without having to take that dog's cancer and send it out. In osteosarcoma, bone cancer, you usually have to amputate the limb, and then it spreads very fast, and it's usually already spreading to the chest before you even diagnose it. So the game is to try, the challenge is to try to stop that cancer from spreading. And these vaccines are offering hope. And so that vaccine is out there too. You just have to find an oncologist that's using it. And if I call it the Yale cancer vaccine, and they do use it in other sarcomas, you'd have to speak to the oncologist for which ones. The general vets can't give it anymore. I used to be able to give it. We gave it in our practice to some animals that couldn't have surgery. And with a release from the owner and me, the veterinarian, that I know what I'm doing, and I'm releasing, all the responsibility comes to me then. And I'm happy to do that for patients that understand what we're trying to do. And but they're not letting us general practitioners do it anymore just yet. They got into trouble with the FDA, so now it's just the oncologists that can do it. So there are cancer vaccines for pets used on multiple cancers. It's just not real good on blood cancers, lymphoma, unfortunately. Things like that don't. We have other treatments that seem to work better, more effectively. Those cancers spread very, very quickly. Hemangiosarcoma, we're getting better at diagnosing it earlier. The breeds that are prone to it, people are aware of it, the German Shepherds, the Golden Retrievers, the Boxers, A lot of people are screening their dogs more often, taking x-rays every year. And so we're picking it up sooner. We're doing blood tests that can let us know if potentially there's a high incidence or high likelihood of cancer in the body, and then we can find it quicker. And if we find it sooner, we have a better chance of giving them a better quality of life, of course. And that's always the whole game, is to try to diagnose it early. It's very frustrating in bone cancer that most of the time the people bring their dog in when it's lame. We take an x-ray and it's already there. It's already in the bone, which means it's already probably spread. And so very aggressive. But yes, there are cancer vaccines for the pets. Ardent Animal Health is the autologous vaccine I use. I love it. I think it's going to get better and better. The work they're doing now, they got a novel adjuvant for it out of University of Minnesota, I believe. And it's called a checkpoint inhibitor. And it helped people in the studies in glioma, brain cancer in children. It helped improve their life expectancy by 40% using that checkpoint inhibitor. That's a lot of time to try to come up with another cure. And so anything that gives you 40% increase, I know it's not a long time when you think of 6 months as the standard or a year as the standard. 40% isn't a long time, but maybe it's enough time till we come up with a cure. There's a lot of things going on in the world that I believe are going to be life-changing for our pets and people. And I think they're going to be out real soon. So anything that can extend that quality of life may buy that essential time. And I don't know that, but that's my thoughts, and that should be shared with owners, and no judgment on any decision that's made. No judgment ever, because that's your pet. It's your philosophy that counts, not mine. But you should have the information.
So we're at our hour limit, but I want to cover again real quick. We don't have to get real in depth with it. Just with July 4th coming up, we know there's going to be fireworks. Some of the best things, if you don't have it in your house already, what are some of the things that are going to be easy enough to get for us before the 4th of July to keep your pets from having too much anxiety?
You have, I mean, most of us vets are open every day next week until the 4th of July, until Thursday. So please call your vet. If it's this late in the game, you don't have time to try the natural things. I like it when you have time for thunderstorms, because you can see if that works for the rest of July and August, but you might not have time before the 4th, because the fireworks are going off now. We're hearing them in our neighborhood, and I'm in the woods. So it's and I know my dogs hear them. My dogs aren't phobic with them, but they hear them. They're looking out the window. They're curious, and what's going on out there. But excuse me. So speak to your veterinarian, and we can prescribe things. Cilio is one of them. Trazodone is one. I don't carry Cilio, but Trazodone is one. There are others. Even acepromazine can, relax them. It's a muscle relaxant. So there's old time therapies that we use that work very, very effectively. Some people use gabapentin. I don't think Benadryl is that effective. It makes some dogs tired. I just don't think it's that effective for phobias. But try it. I mean, it's safe. You can try it. I mean, if your vet's recommending it, give it a try. Maybe they had better luck than I have. Thunder shirts, I like. It works on 10% of the dogs. I love it for those 10%. The 90%, it doesn't do a thing. It's supposed to be the hug. It's supposed to, we all love hugs. I'm a hugger. Brock's not. And so I still hug when I see him. But the thunder shirts, sometimes it helps with the barometric pressure and that hugging effect. That's the rationale for it. So it's worth a try, but make sure you have a money back guarantee so you can send it back if your dog's a 9 out of 10. So but it's worth a try. I think anything like that, it's too easy to miss. So, and one of my tech's mothers came to me, and she was a doubter, and she used it. She was, I'll give it a try. Came back and said, Hutch, that works fantastic. And I was very, very happy to hear that. And she's a farmer's wife who says what she's thinking. I love her to death. I loved her the minute I grew up in a farm background. I loved her the first moment I met her because of her candidness. And that vet didn't know anything. And I just laughed. But in any because I know I can be next. But she still sees me. Her daughter works for me, so I think she likes me. I think I earned her respect. But I love that candidness. I love hearing that. And when she told me that, I believe her 100%. So I say 10% of them it helps. So it's worth a try. And remember, keep them indoors. Don't let them run. This is when pets get lost. Make sure they have identification on them. They get scared, they take off. Crash through a door. People say this all the time. My pet has never done that. And yet, when they have phobias, they do strange things. So make sure they have ID on them at all times. If you're a horse owner, bring your horses into the barn. They don't necessarily like fireworks either, and they can get fearful and injure themselves on the fence or worse yet, escape. So I recommend that too. I used to work on horses till 1998, and we had problems with horses and fireworks when I was out in Long Island. So they're animals too, and they don't understand as well. Some of them get fearful. So just be aware, and be aware that it can happen to any of our animals, and provide them something to keep them safe and calm. And that could just be a little bit of music, and maybe your attention. So I hope that helps. Thank you for tuning in. Like Brock said at the beginning of the show, if you like this show, please give us a thumbs up. It lets the algorithms know that you're listening. It gives them feedback. And remember, don't just live and let live, but live and help live. Have a great week. Be safe, everyone. Happy 4th of July.
What's crazy is my dogs don't react to thunderstorms,
but fireworks
or gunfire.
Wow.
But fireworks.
Wow.
Yeah, right. Gunfire's like, hey, it's Tuesday.
Yeah.
Like fireworks like, oh, something special. Yeah. So yeah, like Mike said, happy 4th of July. We will not be here next week because I will be traveling. So we're gonna take a week off, still ask your questions. And before you leave, please give us a rumble. And follow the show, and maybe join us during the week if you're politically inclined to do so. But we're here every week except for next week, obviously. And we'll take your questions. You can always email your questions to me, wbrbrock@gmail.com. You can always ask your questions on Rumble or Mike's Facebook pages. And we'll try to get to, like we do, we try to get to as many as we can. If we don't get to them this week, we'll try next week. And we'll try to get you all involved in the show. So thank you for watching, and we will be back in 2 weeks.